Hello and welcome. We're about to open up the Microbial report card for 2025. And what a year it was, full of some unprecedented challenges, but also some really crucial lessons in the world of infectious diseases. So let's break down the final scores. So this is the big question, right? How did we actually do? Where did we win? Where did we stumble? And maybe most importantly, what warnings did 2025 send us for the future? Let's dive right in and find out. First up, our first subject on the report card is avian influenza. In 2025, this told a pretty terrifying story of what we call spillover. That's when a pathogen makes the jump from an animal into a human, and it happened in ways we've just never seen before. Now, what's really fascinating here is the contrast. You've got H5N5 on one side, which made huge headlines with the first ever human case in Washington state. Tragically, it was a fatal one. But then you have H5N1 on the other side. This wasn't just a single event, it was a global threat, spilling from birds into all sorts of mammals, including a massive widespread outbreak in dairy cattle. And that H5N1 threat, it just kept escalating. The outbreak in U.S. dairy cattle exploded across 17 states, which led to the first likely cow-to-human case. But the real five-alarm fire, that came late in the year, with documentation of the first ever human-to-human transmission. I mean, that is a line that public health officials have feared we would cross for decades. And if you want to understand just how fast this threat was accelerating, just look at this number, 7. In Cambodia, which we know is a hotspot, 7 human cases were found in June alone. That's the highest number in a single month in over 20 years. It was a clear signal that people were being exposed more and more. This just shows you how unpredictable this virus can be. In Vietnam, an 8-year-old girl developed H5N1 encephalitis. The virus didn't attack her lungs, which is what you'd expect. It attacked her brain. This incredibly rare and heartbreaking case was a stark reminder that we are still learning just how this pathogen can affect us. Okay, let's move on to our next section, viral hemorrhagic fevers. We're talking about diseases like Ebola and Marburg, the ones that can damage your blood vessels and cause severe bleeding. 2025 saw them pop up in new places, but it also saw us fight back with some really incredible innovation. This was a huge development. Ethiopia declared its first ever outbreak of Marburg. The moment this incredibly deadly virus showed up in a new country, it put global health authorities on the highest alert. It literally expanded the known map of this threat overnight. But you know, it wasn't all bad news. At the same time Ethiopia was facing this new threat, its neighbor, Uganda, actually declared its Sudan virus outbreak was over. And that happened back in April. This was a massive public health victory, and it showed that with a real concerted effort, these outbreaks can be stopped. And here's a perfect example of that progress. During the DRC's 16th Ebola outbreak, response teams rolled out these amazing modular treatment centers. Get this. They were able to build an entire 32-bed facility, one designed for better, more humane care, in just 10 days. That is an absolute game changer for responding quickly. Now we have to turn to a really concerning trend from 2025, the resurgence of old enemies. We're talking about diseases that are often preventable with vaccines, but for a variety of reasons, they came back with a vengeance. This slide tells such a powerful story about cholera. Just look at the data. Afghanistan had more than twice as many cases as Angola, over 63,000. But their case fatality rate was a tiny fraction of a percent. Angola's rate was 2.8%, which is just devastatingly high. So the lesson here is clear. It's not just about case numbers, it's the strength of the healthcare system that decides how deadly an outbreak will be. And the scale of the measles comeback was just breathtaking. Vietnam had its largest outbreak in decades, with over 42,000 cases. You can see how that dwarfs even other hard-hit countries like Afghanistan and Romania. This is a direct result of falling vaccination rates, a real failure of public health fundamentals. And then you have Mpox. In 2025, Malawi reported its first cases of a very specific variant, Clade I. Now, to an epidemiologist, this was a huge deal. It strongly suggested the virus wasn't just brought into the country, it was already circulating quietly in the community, which makes getting it under control so much harder. And the threats just kept coming. 2025 also showed us an incredibly diverse range of challenges, from insects, from animals, and from new parts of the world. I mean, this slide is just a quick snapshot of that assault. You have dengue exploding in Brazil, nearly 2 million cases. Chikungunya infecting maybe 12% of the entire population on Reunion Island.
the Oropouche virus breaking out of its usual territory to spread to 11 countries, and even a rare zoonotic jump like South Korea's first human case of bovine TB in a lab worker. The pressure was truly coming from all sides. So we've looked at specific outbreaks. Now let's zoom out and look at the massive systemic challenges that were the foundation for everything else in 2025. Superbugs, the health of our agriculture, and our own preparedness. Take a good look at this chart. It's about antimicrobial resistance, or AMR. That's when bacteria evolve to fight off the drugs we use to kill them. A huge study pointed to India as an epicenter of this crisis, finding that a shocking 83% of patients were carrying these multi-drug-resistant bugs. This superbug explosion is like a slow-moving pandemic, and it threatens everything we've built in modern medicine. And of course, we can't forget the diseases that hit our food supply. African swine fever isn't a threat to people, but it absolutely devastated pig populations. Malaysia had to cull 14,000 pigs. It just goes to show you the massive economic and food security impact of these animal diseases. But, amidst all these crises, there were some genuine signs of progress. In April, the WHO member states finally hammered out a legally binding pandemic agreement to help everyone work together better. And countries like India started using advanced AI systems to scan data, trying to predict the next outbreak before it even starts. So we are building better tools. So, after going through the whole report card, we're left with this one question. 2025 was a year of fire drills and, well, some real fires. It sent us crystal clear warnings about avian flu, about old diseases coming back, and about superbugs. The final, critical question isn't really about what happened last year. It's whether we've learned enough from it to be ready for whatever comes next.